Hey everyone, my name is Jai-La Aponte. I use she, they pronouns, and I'm the Graduate Assistant of Sexual Health Education in the Office of Wellness Promotion. And today I'm going to be talking to you about STI stigma. So first of all, we're going to talk about what STI stands for: a sexually transmitted infection. And basically what it is, it's an infection that is transmitted through sexual contact, either caused by bacteria, viruses, or parasites. And different examples of STIs can be genital herpes, syphilis, gonorrhea, chlamydia, HIV, AIDS. All of those are different examples of different STIs. So what is social stigma? Stigma is disapproval of or discrimination against a person based on social characteristics. So when we talk about STIs and social stigma, there's a lot of stigma around the discussion of STIs. People who have STIs, anything related to the discussion of that will have a social stigma attached to it. So STI stigma is the negative feelings and shame that are attached to STIs, contracting an STI, and the discussion of STIs. STI stigma can include that STIs are dirty, only promiscuous people get STIs, or that STIs are a punishment for having sex. There's a lot more different stigmas attached to STIs and different attitudes attached to it, but those are just a few to name. And how is this harmful when we talk about sexual health education and our own sexual health and well-being? Are associated with shame and have negative attitudes attached to it. It can lead to people not wanting to be tested for STIs for fear that they will have a positive test and the repercussions that they might experience either from a family member, a friend, or telling their partner about their STI status. This can cause a person to not disclose their STI status to a partner. They can feel ashamed of it, and because of that, they may feel the need to keep that from their partner, and that can be harmful for the person that they are seeing. People may not want to seek treatment out of fear of being judged. In a lot of research that I've conducted, people have had that fear, especially people of color or queer people or people of poverty. They have a fear that their healthcare workers will have negative feelings towards them or make assumptions about their sexual activity or anything related to that person. And lastly, another example is just not seeking treatment, period, out of fear of other people finding out. So if someone is on their parents' insurance, they might be scared that that'll show up, that they got tested for STIs, negative feelings from their friends, being made fun of, being ridiculed, having those same attitudes about being dirty attached to them or their partners as well. So the reality of STIs is that STIs are infections, and people of all different backgrounds, sexualities, genders, and ages get STIs, and most STIs are asymptomatic. So what that means is sometimes when someone has an STIs, they will not have any symptoms. And they can have one without knowing it, and if they don't experience those symptoms, they won't know unless they get tested. So the only way to know your STI status is to get tested because of that asymptomatic feature. It only takes one person to transmit an STI, and getting an STI doesn't say anything about your sexual history or who you are as a person. These things happen, and they're more common than we like to think or that we even talk about. The Centers for Disease Control and Prevention states that there are 20 million new cases of STIs each year, most of which affect those between the ages of 15 and 24. So that is where the bulk of the STIs infections happen, between those ages. And STIs can contribute to feelings of depression and self-hatred because of those stigma. And if we don't talk about it, then we don't address those negative feelings and how to combat the stigmas that are attached to STIs. To address STI stigma, we all have the responsibility to become educated regarding how common STIs are, and that STIs are not a reflection of a person's character. It doesn't reflect who you are as a person. You are not a bad person if you get an STI. You are not being punished for having sex. These things happen, like getting sick, like anything else. It just happens sometimes. And getting tested and receiving treatment for STIs is nothing to feel ashamed of. It's a part of your health and your well-being, and it is important for you to get tested. So I hope you enjoyed this video, and we'll see you soon.